Pollution spares no body organ. It affects the pregnancies, it affects the genetics of the unborn fetus, and the children can be born with structural abnormalities. In 1 hour, inflammatory changes set in your body, in your blood vessels, in your endothelial lining, that's your cell lining. And by day 2 to day 5 of exposure, you are predisposed to heart attacks and sudden cardiac arrest. This impact is going to be lethal now and for generations to come. We know for a fact that this is carcinogenic. Cancers of the lung, stomach, kidneys, prostate, galore are up from 30 to 40%. We are inhaling poison. We are going to be impacted. We refuse, as Indian citizens, as Delhi citizens, as tax-paying citizens, as loyal Indians, as proud Indians, we refuse to die early because of apathy of the local politicians.
Hi there. Today we're diving into an issue that's quite literally taking our breaths away: pollution. If you're in Delhi, Noida, Gurugram, or anywhere in the National Capital Region, you know exactly what I'm talking about. The thick, heavy air that surrounds us. The air around us isn't just polluted, it's poison. AQI levels have hit mind boggling levels, and the thick, suffocating smog has been choking us for days. But this isn't just a weather story. This is about survival. Asthma cases are skyrocketing. Children, our most vulnerable, are struggling to breathe. And experts are warning that this air crisis is cutting life expectancy by up to 7 years. 7 years. Can you imagine losing that much time with your loved ones just because of the air you breathe? And here's the hard truth. This isn't new. Every year we talk about pollution like it's a passing storm. But it's not passing. It's here. It's deadly. And it's affecting every single one of us. The question is, what can we do to protect ourselves and the people we care about? Today, we're taking this conversation beyond the headlines. I'm joined by Dr. Sanjeev Bagai, a leading healthcare expert, to break down what this crisis means for your health, your family's well-being, and the steps you can take to fight back. Dr. Bagai, thank you for joining us. Let's start with the most pressing question. How dangerous is the air we're breathing right now? And what's the immediate impact on our children and families?
Good day to everyone, and hope everyone stays healthy and well in this polluted environment. So air pollution, what we are seeing now, especially this year, apart from all other years, which is an ongoing serial phenomena, is a monumental man-made disaster. This is a catastrophe of epic proportions, which have destroyed not only this generation, but many more generations to come. Overall, if you see globally, there are more than 5 million people who died directly because of the impact of air pollution, and out of which 2 million are dying in India alone. That's a whopping 40 to 45% of the global deaths because of an impact of air pollution is in India. What we are seeing now is we are losing approximately 8 to 10 years of overall lifespan of adult life directly because of air pollution. And every 10% increase in PM 2.5, what we call as particulate matter, fine particulate matter 2.5 microns, is giving a two-fold increase. That's a 200% increase in cardiovascular and metabolic events in the body. Every 5 microgram increase in PM 2.5 is giving a 4% increased death rate. More than 10 notches higher is giving 8%, and more than 35 notches higher is giving a 25% increase in death predisposition. Here, what we are seeing in Delhi this year, that PM 2.5 is in hundreds. That means your chance of getting a mortality event is extremely high. It's not only the PM 2.5, it is the other toxic gases like carbon monoxide, SOx, NOx, which is sulfur and nitrogen compounds, and these cause immediate respiratory distress in 15 minutes of exposure. In 1 hour, inflammatory changes set in your body, in your blood vessels, in your endothelial lining, that's your cell lining. And by day 2 to day 5 of exposure, you are predisposed to heart attacks and sudden cardiac arrest. These studies have been published at length in Lancet, British Medical Journal, New England Journal of Medicine, and various other health expert magazines and journals. This is data which is accumulated across the world, and they've done studies across 27 cities in India, 18 cities in India, and this is the cumulative meta analysis as what I have just portrayed. This impact is going to be lethal now and for generations to come. To put it in a very simple manner, pollution spares no body organ. It causes in the heart attacks, abnormal heart rhythms, what we call as arrhythmias, hypertension, coronary artery disease, cardiac arrest. In the lungs, asthma, almost 50% increase, bronchitis, pneumonia, wheezing, chronic obstructive lung disease. In the brain, it can predispose to strokes, bleeding, dementia, 2 to 4-fold increase, Alzheimer's disease, memory loss, behavior, aggression, mood changes, especially in children. It affects the pregnancies, it affects the genetics of the unborn fetus, and the children can be born with structural abnormalities. Stillbirths, small for date and preterm births, bone disease, obesity, a direct link with the leptin involvement of at the genetic level, metabolic dysfunction. It involves the skin, sore eyes, throat, ear, lung infections, including pneumonias, viral and bacterial, overall mental and cognitive health, liver and intestinal involvement, kidneys involved, immune dysfunction. It causes peripheral vascular disease, including thromboembolism. Allergies are very high. We know for a fact that this is carcinogenic. Cancers of the lung, stomach, kidneys, prostate, agglor are up from 30 to 40%. It is anti-hormone. This entire episode affects your hormones of your body, causes infertility, and of course a host of infections. In short, it spares no body organ. We are inhaling poison. We are going to be impacted. We refuse as Indian citizens, as Delhi citizens, as tax-paying citizens, as loyal Indians, as proud Indians, we refuse to die early because of apathy of the local politicians, unable to grasp the situation, not to keep protocols in place. And what we are seeing is a blame game while we die.
Dr. Bagai, I agree with all the points that you've raised. What I want to understand from you is that what can be done right now to reduce the damage? Are there immediate steps individuals, families, or communities can take to protect themselves?
Yeah, so I will divide this in two parts. One is at a policy level. So I think the Delhi government has not been proactive and interactive with the local agencies to get the act together. I don't think their approach has been accurate, and we are suffering. Now, the blame game between one state to another state is not helping any citizen either. You cannot say that the parali burning has decreased. The fact is, it should not happen at all. Someone is saying it has decreased 10%, 20%, 30%. There were early so many thousand fires. Now there are only so many thousand fires. Even one murder is bad. You can't say there were 100 murders earlier and therefore there are only 5 murders now, so therefore I'm very good. That's complete nonsense. Parali burning, Punjab is on fire. We know that. I get patients from there. On both sides of the highway, the crop burning is agglor. Industrial emissions within Delhi. But a large section of what we are seeing in Delhi is local production. That means that in-house defect. So focusing on what we can do. We need proper accountable road laying. We can't have only a stretch of the road tarred and then it disappears in one rain and the rest of the peripheries of the road lying open to dust. Therefore, road dust is a major contributor. Delhi transport system sucks. We know that. We were promised for the last 10 years, 15 years, we'll have world-class transport system like London, Tokyo, Paris. That's nonsense. We've been told wrong promises. This is a lack of commitment and lack of promise fulfilling. The fact is that the Delhi transport system is perhaps one amongst the worst in the world. If it was not for the metro, which was started well before the present government's time, we would have been actually in a very, very precarious position. Fossil fuel, wood burning, and last most importantly is the waste management. So allow me just few seconds on the waste management. We keep talking of landfills, which is in Ghazipur and other places. Those are huge ones. But there are various landfills as open dhalaus, which are in all residential colonies within Delhi. These emit toxic gases. PM 2.5, methane mainly, benzene compounds. These are highly carcinogenic. These are like acid to the body. They are corrosive to the body. And the residents are inhaling this 24 by 7. Can't Delhi government get the waste management right? That's the basic. We pay our property taxes for this. We pay our taxes so that we can have a proper air to breathe. We pay our taxes so that our life is not cut short. The Delhi government
Okay, Dr.
should
Bagai,
get.
I mean, on this particular broadcast, I didn't want to get into the whole political side of it. We've been seeing this blame game happening almost every year, right? What I want to be able to give our audiences today is what they can do on their own individual level, their family level, to help save themselves from this health hazard that is there out there that we're breathing every second.
So I think the Dhalaus in the residential areas need to be contained. Delhi has to become Dhalau free. That's waste management must be set right, whichever agency is responsible. At an individual level, especially the children, the elderlies, and the vulnerables. The vulnerables are one who have comorbidities. That means hypertension, coronary artery disease, asthma, chronic obstructive lung disease, transplant patients, immune deficient patients. They need to protect themselves. So don't expose yourself unless until it is a must. These kind of AQIs, which are 999 or in some areas 1700, these are non-compatible with life. You cannot breathe this air. If you breathe this air, you're causing severe jeopardy to your life. If you're going out, please wear an adequate mask, much like we wore in COVID. Children, especially in the smaller age group, don't expose them to this air because the children's lung capacity is that much smaller as compared to adults. Elderlies who are predisposed to wheezing and allergies and asthma must take the inhalers. Do not self-medicate. Very often, early stages antibiotics for a cough are not required. Please consult your doctor during this environment. The best way forward is to have an online consultation.
Okay. Now, sir, you spoke about masks. I would request you to enlighten our audiences that what type of mask is the best for them to be wearing. Because I see out there are a lot of people who are just putting on those surgical masks that come for 10-15 rupees and walking out. Is that enough to protect you from this toxic air?
So there are two parts to your question. One is the type of mask, and the second, the way it is worn. Even a simple surgical mask is good enough to keep the particulate matter out. Even a handkerchief or a double cloth mask is good enough. Of course, an N95, what we are all familiar with during the COVID era, is excellent. But a simple mask which protects you is good enough. But it has to cover the upper part of your nose, the entire stretch of your mouth, and so that there are no areas as gaps where air can come in. If that happens, then you will be inhaling a lot of the toxic gases and fumes. So a surgical mask is fine. A double surgical mask is even better, or a double cloth mask is equally good, and properly fitting so that there are no gaps as far as the entry of particulate matter and toxic fumes is concerned.
Okay. Dr. Bagai, if you do have a mask around you, could you just show a demonstration to our audiences what exactly they should be looking out for?
Yeah. So this is a N95 mask. This is a triple layered which has a filter, and it has to be well fitted and it has to be worn in an accurate manner, which covers the upper part of your nose, around the ears, and there is no gap either up or at the sides or below. This is the way what we wear in the clinics. But otherwise, a mask, even a cloth mask or a surgical mask, is sufficient, which covers from ear to here and ear to ear. I'll take this off.
Okay, thank you, sir. That was very, very helpful. Now, speaking of damages, we've been talking about the damage it does to your health. How does this pollution affect us at a cellular level, beyond what we can see and feel, what's happening inside our bodies due to this toxic exposure?
So when we talk very often of AQI, AQI is a component of many verticals. So it has particulate matter, what we call as 2.5 microns, 5 microns, 10 microns. It has various gases like carbon monoxide, carbon dioxide, sulfur dioxide, ethane, methane, benzene. Then it contains hydrofluorocarbons. These are carcinogenic, volatile organic compounds, which are again carcinogenic, black soot, what we call as carbon. That's why when you are in a polluted environment, especially people who are wearing a white shirt will have a very dark line on the collar. That's the soot which is in the environment. Then, of course, is the heavy metals like lead, mercury, antimony, and plastic. We'll discuss plastic in a minute if you have time. And of course, the smoke which is there, free radicals, and so on. What this does is it enters into the body and it starts a cascade of inflammation. This is very much like any other infection, what causes, like COVID causes. There's a lot of protein and cytokines which are released, free radicals which are released, inflammatory markers which are released, exactly like in COVID. This affects your blood vessels, it goes into your lungs, into your stomach, into your intestines, into your brain, and all the side effects, what we just mentioned in the early part of the program, is because of this inflammatory mechanism which sets in. Once this becomes a chronic inflammation, then the stage of cancers, COPD, dementia in the brain, heart attacks set in, sudden cardiac arrest. So pollution overall is devastating at a cellular level. It destroys the cell, it kills the cell.
Okay. Now, another critical aspect that we need to address is the presence of pollutants like lead, heavy metals, and as you mentioned, plastics in the air, microplastics. These toxic substances pose serious health risks for neurological damage, from neurological damage to respiratory issue, and even long-term organ damage. Can you tell us more about these invisible yet very dangerous threats?
So, we've reached an era now in which the world is engulfed with plastic. So, very quickly, when we use a plastic bag or a polythene bag or any other plastic, a plastic bottle, a PET bottle, a water bottle, or indeed a soda bottle or a Coke Pepsi bottle, which anyway is not good, and it is discarded, very often it is not recycled in an appropriate manner. It enters into the routine waste. What this does is it degrades down and it forms what we call as first microplastic and then nanoplastic. It breaks down. Now it takes decades for this process to happen. Where does it happen? In the soil. What happens to the soil? It absorbs the nanoplastic and microplastic. What is grown in the soil are vegetables and fruits. Where else does it go? It goes into the water. What water do we get? We get water from the ground level as a water table. This is where worldwide water comes from. So what we are carrying now is an excess load of plastic, microplastic and nanoplastic everywhere. Apart from that, this degrades and also gives emission into the air. So you're also breathing in the toxic fumes as a byproduct degradation of plastic. Plastic contains 4 or 5 major items which are disastrous for human beings. It contains a compound which is called as bisphenol A. This causes cancer, infertility, heart attacks, and damages the fetus, hypertension, diabetes, and coronary artery disease. Then it contains arsenic and antimony, and it contains DHT. All these items are anti-hormone. They cause infertility. It disrupts your estrogen. The molecule of nanoplastic displaces estrogen in the body. Therefore, the maximum side effects of this plastic havoc in our lives is more towards women. With regards to other things of metals, lead is a huge compound which is emitted into our environment. It's destroying the ecosystem. In children, we've seen lead poisoning quite often. It need not be to that level in which the child is dying, but sometimes we've even seen fatal episodes of this. Lead, the earliest thing which we pick up is lack of concentration in children, handwriting changes in children, mood changes in children. And if you get a lead level done, it's high. It's easily treatable, but it does cause organ damage. It causes acute and chronic kidney disease. It involves the functions of the brain. It causes lack of attention span, behavioral disorders, aggression. It presents very much like a aggressive, dysfunctional child. Apart from that, it damages the liver. So these are things which need to be addressed. So I have said this very often, we need a very holistic, comprehensive approach, not only to combat winter, but pollution is 12 months a year, and we have to have a separate department at a government level to manage this.
Okay, and Dr. Bagai, before I let you go, I would just request you to share some more tips, if you can, with our audiences We have spoken about how people should not be venturing out if not needed in early mornings and late nights because of the pollution levels are the highest at the time. What I want to understand from you, and for you to share with our audiences, is that when they're at home, what can they do? We know about these air purifying plants, or should everyone, because everyone cannot afford an air purifier at home, what should one do while they are in indoor areas as well?
So, being at home, my prayer and request to every Indian is please be an environmental champion. Make sure that the green cover in the environment is not filled with trees or not cut. You cut a tree, you're cutting a human life in return. But this is damaging our complete ecosystem. But within the home environment, we very often talk of outdoor pollution. But 20% of overall pollution deaths are because of indoor pollution. So focusing on indoor pollution, odors are not good. So the liquid form of or the coil form of mosquito repellents give a huge amount of toxic fumes in the microenvironment of the home. Earlier days, it used to be kind of ingredients in the ceiling which was used to keep it as waterproof and temperature proof, what we call as asphalt, but that's not used any longer. But paint causes lead emissions in the environment. If your filters are not clean, and especially if they are kept in the wrong part of the room, they give oxidized molecules in the air, which can air filters themselves, if they are not good, they can cause harm. Cooking, especially, you should have a suction chimney so that the fumes are not emitted. Too much of body odors in terms of perfume sprays is obviously an allergen. There are certain
Yep.
plants do not keep within the home environment because they can precipitate pollen and allergies. Carpets which gather dust, curtains of cloth which gather dust, there is a specific way to keep it clean so that the microparticulate matter is not emitted. The old system of a jhadu in Indian home is not good because it
Okay.
spreads the dust particles from the ground for hours later in the environment. So I think we need to concentrate on home indoor pollution very much. Mold in the walls because of dampness is a huge irritant to the human health. This is a part of the indoor air pollution. So these are small measures which we need to keep so that we keep our health very much well.
Okay. Thank you, Dr. Bagai, for sharing such valuable insights with us. To our viewers, I'd like to end by saying this: the air we're breathing is a direct threat to our health, and we cannot take this lightly. Please make wearing masks a priority, especially during these hazardous days. Avoid venturing out during early mornings and late nights when pollution levels are at their worst. Protect yourselves, protect your loved ones, and let's take every possible step to stay safe. Here's hoping for cleaner skies. Thank you for watching.